As a part of your protocol, your doctor has instructed you to use Menopur 37.5 units. Menopur can be purchased at the Markham Fertility Dispensary, and it's stored at room temperature. Menopur comes in a box typically of 5 vials of medication and 5 vials of diluent, although you may purchase the medication individually from Markham Fertility Dispensary. For your dose of 37.5, you'll need 1 vial of powder, which is the medication, and 1 vial of liquid, which is the diluent. You'll also need a syringe, a Q cap, a needle tip, and an alcohol swab. To get started, you'll take the cap off of your powder vial and off of your diluent vial. Use an alcohol swab to clean the top of each vial. Then you'll open your Q cap. You'll see the sharp part of the Q cap in the middle, and you'll pop that onto the diluent first, and then you'll open the syringe, pull back a little bit of air in the syringe, and twist that onto the top of the diluent. Push the air into the diluent, turn it upside down, and pull back to about 1 ml of diluent. Then you can twist that off and set your syringe with the diluent in it down on something clean. Pull the Q cap off of the diluent vial, and you can discard that diluent now. And then pop the Q cap onto the top of the medication vial with the powder in it. Take your syringe and twist that onto the Q cap. Push all of the diluent into that medication. You'll notice that the white powder mixes pretty quickly back into this clear liquid. Once that's happened, you'll turn it upside down and pull 0.5 mils into your syringe. So half a mil. Just flick the syringe so that most of the air is not accounting for your volume. And once you've got half a mil of liquid into your syringe, you'll twist that off, and then you'll open your needle tip, twist that on, take the lid off, and just push the plunger up slowly until you see 1 blob of fluid come out the top of your needle. Now your Menopur 37.5 units is ready for injection. You'll notice that there will be remaining medication in the vial. Put that in the fridge, and you can use that to make your dose for tomorrow. In the next part of this video, we'll go over how to landmark and inject a subcutaneous injection for your Menopur. Now that you have your medication prepared, here's a video on how to perform a subcutaneous injection. First, these injections are going to go into your abdomen. So you'll pick a spot 2 fingers away from your belly button and inject anywhere in your tummy. The injection is going into that fatty layer of tissue right under the skin. So 2 fingers away, anywhere in your tummy, just like this. When you're doing your injections, you'll pick a spot and then you'll rotate your sites. So try not to poke into exactly the same spot as you did already today or yesterday. Try to rotate the spots a little bit, even a finger away is helpful. When you're ready, you'll use an alcohol swab to clean the area that you're going to inject into. And then you'll give that a few seconds to dry. You'll take the cap off of your prepared needle and pinch your skin where you're going to do the injection. You'll inject at 90 degrees all the way in. Push the plunger on the syringe down until all of the medication has been delivered. Then you can relax your skin and pull out the needle. A little bit of blood, a little bit of liquid might come out. That's okay, it's normal. You can use a tissue to hold the spot until the bleeding stops. And then when you're done, make sure that you put your used needle into a sharps container or your medical waste bag.